Trelegy Ellipta is used to treat COPD, including bronchitis and emphysema, and it is also used as a maintenance treatment for asthma in adults. The inhaler contains a combination of 3 medicines: fluticasone, umeclidinium, and Vilanterol. Fluticasone is a steroid that prevents the release of substances in the body that cause inflammation. Umeclidinium is an anticholinergic. Vilanterol is a long-acting bronchodilator. These medications work by relaxing muscles in the airways to improve breathing. This inhaler is not for use in treating an asthma attack or bronchospasm attack. Vilanterol, when used alone, may increase the risk of death in people with asthma. However, this risk is not increased when Vilanterol is used in a combination product with fluticasone and umeclidinium. Common side effects may include cold or flu symptoms such as runny or stuffy nose, sore throat, cough, chest tightness, a lung infection, nausea, vomiting, constipation, diarrhea, joint pain, headache, back pain, mouth sores, hoarse voice, mouth pain, or changes in your sense of taste. This material is provided for educational purposes only and is not intended for medical advice, diagnosis, or treatment. Always consult with your healthcare provider.